Good afternoon, everyone. Thank you for being here. I think you used two words, innovation and sustainability. They're the most, I would say, the buzzwords in healthcare, which we hear, and everyone wants to talk about innovation and sustainability in different lenses. But on this panel, let's just dive into what the areas we want to cover, and we have a few questions. I will probably just go in the same order and ask the questions as we sit through the table. What do you think, sir? What are some of the key challenges on sustainability of healthcare services, which we see within the health system in general and UAE in particular?
Thank you so much for the organizing committee, Dr. Ravi Gupta and the team here for inviting me to attend this excellent seminar. Being in this country for the past 25 years, I was part of the development of healthcare system in UAE, starting from Abu Dhabi till Dubai. The challenges that face any proper and resilient ecosystem, especially when we talk about healthcare system, there are many stakeholders in this. First is the actors. Who are the actors? Who are the one who participate in the healthcare system? And the second one is the system itself. What are the processes that build up this system? What are the innovation that facilitate the process implementation? And the third part is the product, which is the customer care, the patient care. So the sustainability needs some sort of intermediary, and those intermediaries connecting all those into a system. We call it successful, dynamic, and proper healthcare system. So to build up a sustainable healthcare system, you need to focus on many parameters. First, if we start with the actors start by the patient himself, by the community, by the population, by the regulator, and also by the healthcare providers in many levels. So if you look into the strategies and based on the experience that comes out of post-pandemic, that the countries that focus on healthcare education to the people, that build up some sort of preventive strategy rather than a curative strategy. When you go and to look, people are planning open hospitals. Hospitals is not going to provide good healthcare system, but prevention provide good healthcare system, because it's been said in Arabic, al-wiqayatu khayrun min al-ilaj. Prevention is better than treatment. So to build a resilient ecosystem, we start with the people themselves. We have to raise their level of awareness about their health disease. As you know now, a lot of money being spent in treatment of diabetes, a lot of money spent in treatment of ischemic heart disease. While starting with healthy lifestyle, starting with raising the awareness about the importance of managing hypertension and diabetes, prevention of those diseases, will end up having less demands on the hospitals. Adding to that, the other part is these hospitals and the healthcare providers. They should design their services in order to minimize the need to come frequently to the hospitals. You need to start with the changing the mentality of the doctors. The doctors should understand that patient is not only medicine given or surgery done. It's how you educate the patient prior to surgery and post-surgery, how you build up a partnership with the patient, so that and this will end up having something called value-based care. Value-based healthcare means that patient is aware, patient is partner in the treatment plan, patient is well informed about his disease, And this will decrease a lot of problems like litigations, complications, and that burden the health system. I would like to conclude my points is to build a healthy, a sustainable ecosystem, you need to build up the intermediate relationship between the actors, which is the patient, the doctors, the nurses, the communities, and also the process itself. I bet many hospitals need every year to revise their hospitals to be more patient-oriented hospital to make this the sustainability. The third part, which is the product of this, will be healthy people. So, in my view, if I become a minister of health and I have a budget, 70% of budget I will spend on prevention, not on a treatment. Thank you.
Thank you so much. I think what you've just done is you've summarized global health problems in a span of 5 minutes, and it's on the right path of prevention and taking care of the population and controlling them in a way that there is less burden on the health system. Yeah. Okay, just moving on. I want to touch a little bit about some of the factors which hospitals and centers they consider when they look at implementing new technologies, and not just from a technology point of view, but how do we make sure that it is sustainable and it is implemented throughout the health centers.
Thank you. I believe that I can put the question into two ways, like adoption of new advances and innovations in hospitals, and that's effect on sustainability of the healthcare provision. Am I right? Okay, so I'll try to put it very quickly in punch points. I mean, what do you mean by sustainability in health services? That's a big question. Is it sustainable stagnation? Is it sustainable development? What is it exactly? This is the definition that always very loose and lax. I mean, sustainability in health services is mainly to enhance the current services without jeopardizing the future healthcare for the coming generations. So you have to balance between what's happening now, putting the foundation for the future, and having a plan for the future to be continuous. The health system now is complex. It affects individuals, it affects society, it affects government, it affects the health economics or the economy in the country, and it affects the planet. We know that health systems are the worst production for carbon emissions, and there was on airplanes, cars, and everything. That's almost account for 35% of the pollution in the world from non-recyclables, from waste products, radiation, and so on and so forth. And this all comes now, we are a hub for COP28, where people are going to focus on that. So innovations, okay, innovations can be divided to two types, okay, mainly. There is innovations that are used and innovations that's coming with deep tech. Deep tech are the foundation for future innovations because you can branch out of it. The current innovations is directly to use, like an app or a system and so on. And also, the whole idea is to have a continuously sustainable system of improvement of quality of care. And quality of care means, as my colleague Professor Taha here said, is prevention and cure. All right? So these two areas is quality of care. The better care you give to your population, the better outcomes, and that can be measurable. So the current innovations, if you see them, we call them disruptive innovations, they will change the way we provide healthcare to make it more efficient, easy, reproducible, and measurable. So every innovation in the world upgrade what usually humans do. We like to go fast. We started with walking, then running, then we created shoes, then we created wheels, back of horses, cars, planes, and rockets. So everything is related to the dimensions and the speed. So the innovations currently is to provide the best quality of care in a short time frame for the largest population possible. And for example, we have a lot of AI. AI, or people call it artificial intelligence, and would like nowadays to call it augmented intelligence. It will do the same job, but in a shorter period, less errors and high quality. And this is used in radiology, used in histopathology, used in endoscopy, where you can characterize the polyps. Okay, used in pathways, like they can organize the rota for the doctors and the nurses. They can shorten the time of doing things. And I give you a simple example that's coming up, especially with the new Google chatbot, right? You'll be sitting with the patient, taking history, talking, examining him, coming out with a plan, explain to him the medications, give him a consent form, and explain things. And the AI will pick up the whole conversation and write in details the history, the examination, the findings, and the plan. So the time you used to spend in dictating or typing or talking to your transcriptionist is invested in direct communication with the patient. So the quality of care, patient satisfaction, planning will be better because you are not diverting from things. And automatically the system will tell you this patient is known to have allergy when he visited Sulaiman and Habib, for example, hospital. He's got allergy there, picked up from the central pot or the box. So you have to change the medicine. They give you suggestion. This is going to be better. So the quality of care is going to be better. The time is going to be better. You're going to have less errors. And this is one of the things that's coming in the future other than just the normal AI. Distribution of medications, automation of things is endless. And also, we have to remember sustainability doesn't come without having satisfaction of your staff, your patients, your stakeholders, and regulatory body. It's very, very important to be holistic rather than point focused. I think 3 minutes will not usually be enough to stress the points, but I hope that I gave an idea where people can raise questions and look for answers as well. That's what's so important. Thank you.
Thank you, Professor. Thank you. Just if I can add on to that, I think technology and sustainability is one thing, but a lot of technology which is very well integrated and gives access to let's say the clinicians, to the patients, or to the regulators at a population level also helps getting access to that information so that reforms and initiatives can be taken to make healthcare sector much more sustainable. So I think integration of technology will also play a very, very key role in ensuring that there is sustainability across.
What you said is exactly true, but with reference to the previous panel, okay, about AI, for example, will not change things because we need the human factor. Human factor is going to be there, with no doubt about it. And we want true human factor, because AI can mimic human factor 100% now. Okay, it will give you a voice of a person, talks to you 100%. You'll never know that this is a machine. But the touch that we have it will not be changed, but they will have more time to be with you. And instead of the nurse running around to register your blood pressure and pulse rate and things and go to the next one, this will be done automatically. While she will come and put a hand on your shoulder and said, how are you doing today? So we also enhance the human factor with things. I'm going to let other people.
Absolutely.
Well.
Thank you so much. Okay, Kartik, I'll move to you. Now there is always a balance between technology, sustainability, and profitability, which is again important for the sector as well. And what are some of the practices which providers have embarked on to make sure that they're sustainable, at the same time also maintaining their profitability so that they can add back to the sector?
I think, thanks for giving a good light on the topic, so I can continue from that light. So we often talk about this perfect picture where we have got AI helping us, and you have innovations helping us. You've got genomics, you've got all kind of innovations and technology which are there, which helps in the system. But on ground reality, when we see, many of these are not even accessible to most of the providers. If I take some of the biggest providers, probably very few even have one common health information system. So what we are trying to envisage or dream or aspire about, there's a big gap between what is there on the ground. And unless we integrate the entire innovation tools available in the market, that profitability balance will not come. Reality is, you have in this geography, UAE, you have 50-60% of your spend happens for outpatient. Outpatient is transactional over here. It's not even end-to-end, one member being managed by one payer or one provider. It is still transactional. Today the patient is going to this clinic, tomorrow he will go to other clinic. There's no end-to-end hold on that spend which is happening. So we are at that stage on ground, and then in that case, if we think about implementing this integrated health system, it's a massive task. So I think to answer the question, it has to be profitable if we use the technology and digital innovations which have come into market. It has to be sustainable if everything is used in the right sense. For example, you have 3D printing of orthocast. We know that it adds to convenience, it adds to speed, it brings down the cost. But how do you can count in UAE how many orthopedicians are ordering a orthocast, a 3D printed orthocast? No, it's just an innovation which is there in books. We talk about it, and that's it. So we are talking about replacing AI with human, but forget about that. First, at least replace material with material. Then we talk about human. So I think a lot of this thing is a behavioral change of the market. Yes, we have come from physical banks and restaurants to online. So healthcare is at the point where it's a last adopter of this innovations and technology. So it is at the start point of that. So I think a lot of behavioral change will first has to happen. And unless providers take up the initiative in hand-holding the stakeholders, I would not even say just patients, all the stakeholders. You have doctors, patients, payers, the complete vendor system, and the regulator. If the provider doesn't play the role of bringing change in the system, it will remain to dioceses and panels. Thanks.
Thank you, Kartik. And again, what we've seen is that's why there has to be a balance between sustainability and profitability, which sometimes prohibits a lot of providers to go down that path, because they also have to apply a commercial lens on operating the systems in the region. Thank you. Namit, I want to talk to you about what are some of the emerging digital health solutions. Now we're talking about HIS and integration, but beyond that, what are some of those new age technology and solutions which you see will radically transform the sector and can bring in a lot of value and sustainability?
Thanks for the question. And before I start, maybe I'll just introduce myself quickly. I represent W Health Ventures and 2070 Health. We are a venture fund and a venture studio building in India and the US, relatively new to the Middle East market. Compared to all the panelists here, you might not have heard of our name, so I thought it would be worthwhile to talk about the fund. Quickly jumping on to the question in point, what is the digital health innovation going to look like? I think our framework is fairly simple. There are 3 types of innovation that can impact the overall healthcare ecosystem. First is, clinical innovation. Are there new areas within the medicine which can change the way how healthcare is delivered? Simple example being obesity, and now there is medical weight loss, the likes of Ozempic and Mounjaro, which are making the wave and are taking headlines globally. That's the kind of clinical innovation that we need to bring to the masses. And whether hospitals which are in the business of saving people from dying will do that, or whether new age digital health companies will do that? That's a key question to be answered. The second type of innovation that we think about is more business model innovation, which essentially means that, and very similar to what Kartik is also doing, essentially you have existing innovation from digital health companies or single specialty models. Do we need to create separate distribution? Because hospitals already exist. There are probably 154 odd hospitals in UAE, if I'm not wrong. Do we need to create new infrastructure? Maybe the answer is no. Can we partner with existing hospitals and bring out some of this innovation that exists elsewhere? And that's the business model innovation, which will only address access and provide better care, more preventive health solutions to the patients. And my panelists earlier were speaking about preventive health. I think that's one solution wherein you can bring an obesity solution, a chronic pain solution, or a mental health solution, which a hospital might not be very interested in building itself. That's the second type of innovation that we think is going to affect the digital health ecosystem in the Middle East region. And lastly, AI is the buzzword, so I would have missed the bus by not talking about it. Within artificial intelligence, we've been talking about augmenting capacity of radiologists, of histopathologists. All that, I think, will take some time to win the trust of doctors for AI adoption is going to take some time, and rightly so. You need the right clinical guardrails when it comes to artificial intelligence for purely medical reasons, because at the end of the day, we are talking about a patient's life and death, and you can't just rely on AI. If I were to ask a question in the room, how many of you would rely on AI for diagnosis of your disease? I would love to see a show of hands. The answer is 0. No one is relying on AI for their diagnosis, right? Except one, yeah. So, that's clear. We're talking about AI, but it's not there yet. It will take at least 3 to 4 years. And what we need to do for that is start with AI co-pilots. Can the data set that is being used, the large language models that are being used for augmenting this clinician capacity, can the feedback loop be completed with clinicians? Can we feed into the LLM back and train it better so that it becomes sharp enough and correct enough in the next few years? That's the future of artificial intelligence, but that needs to happen today. On the contrary, what we can start with is all the administrative tasks. Your nurse efficiency, your discharge automation, RCM, prior authorization, all these things can actually start happening, which is already happening in many countries, including in the UAE. So, just to summarize, those are the 3 types of innovations which can affect digital health and create impact for both patients as well as existing hospital infrastructure that has been created. And that keeps us excited for the digital health ecosystem in the region. Thanks for having me.
Thank you, Namit. And I also agree, improving healthcare would not necessarily mean adding more hospitals or more clinics. It's also about how do you more efficiently utilize what we already have and create more value in the system. So,
absolutely.
Dr. Rashmi, over to you. Last question. We always talk about 2 time zones, before COVID and after COVID. I want to know from you, what are some of those lessons learned from the pandemic which could help future-proof healthcare systems, and we can imbibe those as we go forward and evolve the overall sector.
Thank you for asking me the last, because I think so most of it is covered. That's what the entire ecosystem of healthcare is. But thank you. In fact, I have a very unique strength point to talk about, that I am chairing a financial services company, out of which one of the major vertical is health insurance. 1. Second, I am a doctor by myself and I am an expert in public health. So that's where the COVID comes. And the third is that I belong to India, because I am the biggest innovator in health as a country and the biggest consumer of it. And if I have to talk about the global health, the major aspect of it comes from India. One, our doctors are all over the country doing research and trying to work out. Second, we are the only country which works hugely on preventive, curative, and the well-being. And we have a documented proof for maybe more than 10,000 years old, that's as old as the civilization is. Third is that it is a dichotomy. If we are, COVID, pre-COVID, post-COVID, the whole concept of healthcare has changed. Earlier, it used to be the health infrastructure, how defined, how structured the healthcare is. It is an institution in the world that is going to come with a force. This is where the maximum economy in the nations, most of the countries probably after defense is being utilized in. And yet we are so underpenetrated. But post-COVID, what has really changed is the concept and the mindset. And the mindset is that the structured healthcare that used to be coming from the defined pharmaceutical world, it has got into the indigenous health, medicines, and so on and so forth. So does this dichotomy where we are talking the whole force is being ruled, the whole concept, whether we're talking about AI, we're talking about the hospitals, whether we're talking about all the different economy in the healthcare is being governed by the pharmaceutical lobby, the world, and all that. I'm sure they'll hate me to talk about this. But if we are talking about actually first is the right of health, which is supposed to be, we've been talking, most of the countries believe in that. And most of the countries, a matter of law is also providing that, as a matter of human right is providing that. Having said that, where and what is the ecosystem of health that we need to define? All of us have got different definitions because we are all governed. I am a corporate and I should be governed more towards the structured. Now the hospitals are coming over. There have been Fortises and the Maxes of the world, and they have been great pharmaceutical companies of it. And yet COVID was touched by a person on the street as well. So how do I actually look after them? That is where I need to understand where is the ecosystem for all these things. And yet we have to do a cost-benefit analysis of all these things where it really works. And that is where everything else should be talked about. We are talking about AI, great. If it wasn't there, it really didn't matter to me. I would still look after my patient the best way. What am I going to do with this AI is something which I really need to work on it. Am I adding the cost to it? Am I really creating a patient satisfaction to that level? Am I really enhancing the medical tools so that I can actually, end of the day, penetrate to see the lowest in the bottom of the pyramid? All these things will only happen if we are today in the world. In India, we are just 12, 13, 14% penetrated. Am I able to penetrate through all these things? More than 80%. If I'm not able to do it, trust you me, there is no revolution coming. And it cannot come in these many ways. In fact, all of us have to just contribute on three things where we talk about the sustainability of the health. Forget about the infrastructure. We still didn't have the 5-star hospitals, but we still need health. How do we really create that and yet add to the GDP of the nation by actually creating a strength in the health? One is, of course, providing the health in that way. So one is that what is the insurance benefit that we need to give? What is the kind of adequate treatment, which is a combination of all the three things, which is preventive, then it is curative, and it is indigenous health. When I'm saying is indigenous, my health in my country, whether it comes from Ayurveda or Ayush, all these three things should actually be there. And then how much role should the pharmaceutical world should have here to define the culture of the health? We saw that. End of the day, we had all the vaccines. We are still looking at the benefit or loss of those vaccines coming from the great, great giants. But how did country like India combat? And today my Prime Minister talks so good about that how well the sustainability of health is. It's only and only because while I was doing that, I was also not ignoring the indigenous strength of the health care things in it. And then, of course, for data and for the research and everything else, and actually empowering the doctors with the artificial intelligence, IoT, and all the other activities, that is where we have to do it. And this is one of the most unique, in fact, in the entire world. If we really need to talk about how the GDPs from our country, we are aiming to become a 5 trillion economy. We are in the top 5 economies of the world now. So how do we really attain that? So that is something which we have to basically, with the same cost and the same budget that we have to really reach out to the most important. In fact, again, the uniqueness in a country like ours is that we are a very, very young population country, and yet our elderly, our geriatrics are the most healthy. And that is, I don't have great benefits of the pharmaceutical world in my country. So in fact, I really feel we have to have these combination, permutation of different countries who understand the same understanding. Like Cuba, a dot of a country, talks about the preventive health like nobody does. That is the country which we need to emulate. Are we really very effectively talking about the technology in the healthcare system? Is it really worth that much to invest so much? Is it value for money? Really? I don't think so. We have to have very basic technology. I don't need to have a moon NASA technology for my healthcare to provide that kind of an ecosystem. I do not need to actually increase the budgets of the healthcare. I need to expand that budget to reach the right place. Unless and until that is the basic building block. I have to create the basic fundamental foundation. If we are able to do that, then we have to look around what are the Asian countries, how do we need to do it, then what are the lifestyle disorders, how we need to work on it. We have still been there irrespective of the healthcare. Now we have added the healthcare in a way which is so fashionable to talk about, and we have panels to talk and work upon. So my only 3 things which I really want to conclude my talk is that healthcare cannot be made as one standard global healthcare. It has to be understood in the way the countries work in that perspective. Second is, unless and until we really develop the indigenous systems, whether it is China, whether it is India, or the countries like this, I don't think so we can integrate it very well backward. Second is the research. We have to have a common platform for the research understanding, rather than having a research in a close-knit platform and talking about one vaccine which one country creates and then we all have to use without actually taking my research data. I need to be participating in that research. You have to create that for me, and that is where the data sharing should be. So my thought is, while we are talking about preventive, curative, and we are talking about well-being, we have to be very mindful of the approach that we take to reach that. Thank you.
Thank you, Thakrar. I think.
Thank you so much for lovely presentation. I think you said that do we need to invest in advanced, complex technology? You think you go for basic, I think. I want just to say from the common practice now, the nightmare of all insurance company is the overutilization of the imaging and the lab services, sometimes unnecessarily. So
absolutely, where you need an X-ray, you don't need an MRI. We have to basically categorize why the technology in the healthcare is really important, but we need to really understand how much and what much.
That affects the sustainability. We need to go back to the education of the undergraduate. Doctors, graduates from medical school do not know how to examine a patient properly, how to elicit physical signs. Okay, abdominal pain, send CT scan. CT scan will solve the problem. By the way, artificial intelligence is available since 90s, by the way. Nobody knows about that. ECG usually give you whether this is ECG is normal or abnormal. In a study conducted in UK, that the ECG interpreted by the machine to be normal, in 40% it is abnormal. So artificial intelligence, I love the expression of my colleague, Professor Rahman, when he said, augmenting, not artificial, augmenting healthcare. So we need to go back to the basics. I belong to the medical studies in the 70s. We don't have CT scan and MRI. We use our hands, our stethoscope, and we treat hundreds of patients without, and believe me, there was a restriction to do more than CBC and urine test. I was head of emergency in Qatar. I was not allowed to do more than 2 tests in the evening. I have to use my skills in examining abdomen and eliciting physical signs. Now, is it cost effective? Most of the hospitals now are complaining about cost. When you look into the cost, you can see the cost of lab and radiology equal to 25% of their cost. Because doctors are abusing this, using vitamin D, for example. Vitamin D is highly requested by all doctors. And that's why now DHA established something called NABUD. So doctors should go to NABUD and see if this patient has this test done before or not. That's to limit the abuse. We need to change our mindset. We need to change our culture to be more patient-oriented, not machine-oriented. Thank you so much.
Thank you. Thank you so much.
Sorry, I know that we're running out of time, but it's very exciting discussion from different areas, from doctors who are managers, from doctors who are practicing, from health economics, from doctors who are policy makers to financial institutes. I'll tell you something that's an irony. I remember early on in the House of Commons in the UK, they said, let another influenza comes, it will kill all the vulnerables and old people. So the cost of healthcare will go down. Do we like that? No. Don't invest for health of the elderly. Once you are a pensioner, you're no longer a taxpayer. We'll let you go. Does that fit with us as humans? Profitability. Is health provision is for money or for well-being of the human race? That's another question. Are we targeting profit in health provision? The answer, if you're doing that, you're on the wrong path. Profit will become a result or outcome, not a target, not an end destination. You have to look for quality of care, productivity, efficiency, and cost effectiveness. You will create profit, which partially should be reinvested. Second, when we talk about the need for disruptive innovations and new things, the train has started the journey. Nobody's going to stop it. India, for example, is a big hub for that. If we say, stop it, what do you think is going to happen to the young generation that has got brains in India working day and night in startups? That's going to hit us economically, and that's the sustainability for the future generation affected. Whether we like it or not, India have rockets going to sky, and so UAE send astronauts, and NASA is sending every day, and Skylab is going. So travel in space is no longer for one nation or two nations. China, Russia, it's now became everywhere. When our astronauts come back with super bugs, how are we going to diagnose and manage? You think that the bugs coming from space are going to be the same bugs we have here? You think that COVID-19 is going to be the same COVID? There is another COVID-30 coming. So we have to be holistic, precise, open the door for innovations, use what we need now, keep the rest to when the needs rise up, and think forward. And for our financial and venture capitals, we change. There is nothing called profit anymore, no bottom line. We have triple bottom line. Patient or people, planet, and profit. So we still look for people, planet, and profit. The young people who invest in health, which is very poor investment usually, now they look at the ethics behind it. If you are profitable only, they don't care. They don't see what you give back in quality of care to humans and benefit to the society. Even your profit is low, they go for it. And even some of the biggest investors, like pension schemes, look at your ethical rather than your profit. So let's see it roll, be part of the change. Change is inevitable. They say in Game of Thrones, winter is coming. So we have to be ready. Thank you.
Thank you. Thank you so much, panel. I really appreciate your time and the insights you've shared from your experience. Thank you so much.